I want to turn our attention to an international story that's developing, causing widespread concern. The World Health Organization declaring an international emergency in the Democratic Republic of Congo. It follows an outbreak of Ebola. It's thought at least 80 people have died from the disease and more than 350 cases have been recorded. But there's warnings of a significant risk to the wider region. Let's take a closer look at where it is. Well, the outbreak began in the DRC in Central Africa. It's eastern Ituri province, identified as the epicenter, and it's where most of the cases and deaths have been recorded. The World Health Organization has since confirmed cases in Goma, where the infected person reported 2 cases in the Ugandan capital, Kampala, where a Congolese man has died from the disease. Well, WHO officials have been travelling to the DRC to help coordinate a response, but have warned neighbouring countries should not start closing borders or restricting travel. Let's speak to our Africa correspondent, Yusra El-Bagir, who's in Johannesburg for us. And talk to us, Yusra, about the situation in the region, that the cases there, 80 deaths, hundreds of suspected cases as well. This is also not the first time the DRC has been blighted by Ebola, is it?
I mean, this outbreak is being described as the perfect storm. You've got a really difficult security situation in Ituri province, which is also a gold mining province, and where conditions could have been very much conducive to this kind of outbreak and this rapidly spreading number of cases, rapidly increasing number, but also the fact that the patient zero, the first detectable case, has still not been identified. Now, that's a huge concern to health workers on the ground who've told us that contact tracing is very much a key part of containment for this sort of outbreak. And because of the fact that Ituri has a lot of urban areas built around this gold mining boom, that it's a very densely populated area, and it also does make it difficult to track down people given the spread, given the movement of people, not just across the DRC, but also to neighboring Uganda. So that makes it incredibly difficult. We've also got the fact that there is a very poor healthcare infrastructure, and some of the reports on the ground indicate that people are going to places of worship and spiritual leaders before they're going to medical facilities to speak to doctors about symptoms. Another thing is that the virus is very slow to detect. This Bundi-Bajau variant is not only very fatal, but it also has a slower detection time beyond the 6 to 8 hours that is expected of the Ebola virus. So that, again, so you've got all these variables that make it very difficult to contain the outbreak, and that's why we're seeing the number of cases increase so rapidly. The National Health Minister has been on the ground in Bunia, which is the capital of the province, has told people to get to sites, treatment sites. They've isolated 3 treatment sites for people to go to, but we've been told by local journalists that they are fearful. They're scared to go to these treatment sites, that the protocol hasn't been established to a degree that they feel comfortable with. And I think people will have a lot of fear. People with symptoms may have fear about going to those treatment sites as well, given the fact that this outbreak has been going on since last month. The first known fatality was at the end of April. And so there has been time for this virus to spread, and there is a sense of impending doom. There's a sense of worry considering this particular strain, and the last outbreak in 2007 to 2008 saw 139 cases and at least 39 deaths. So there's a lot of awareness around this strain being a difficult one to manage, but the DRC has also had an outbreak between 2018 and 2020 that saw at least 2,300 people killed. Now, the authorities are saying that this experience and this history gives them the know-how to contain the outbreak. But there is also that kind of muscle memory that people have around the devastation that the Ebola outbreak can cause. We saw in West Africa in 2014, 11,000 people die across different countries. And if this isn't contained rapidly in a place that is difficult to manage in terms of contact tracing and identification, then we could see a lot more deaths.
In Yusra, I was reading some of the decision-making behind the WHO making this declaration, and in one of the paragraphs they reference a kind of pretty crucial point: insecurity in the region and also the humanitarian crises resultant of that. Talk to us about how that might potentially hamper efforts to treat and find those affected.
Well, the Africa Center for Disease Control has said that the sustained attacks from rival armed groups and terror attacks make the setup of treatment centers and protocols very difficult. We just saw 8 days ago an attack that killed 69 people from a coalition of armed groups. We also know that armed groups are active on one of the main highways, the Mombasa Road, that leads to Uganda and South Sudan. So that makes movement and logistics very difficult, but it also, again, speaks to the vulnerability of the population. It speaks to the fact that these healthcare facilities are very underdeveloped in conditions where people are really just focusing on their daily survival, living amongst armed groups that are clashing but also attacking the civilian population. That will also make the coordination of a global response, of a regional response, much more difficult, because you do have to consider the security of the healthcare officials that are coming in, the security of the experts that will need to come in to Ituri in order to contain the outbreak. I mean, even when we consider, as journalists going in, we are also factoring those security conditions. So just thinking about people on the ground and how they have to add another thing to their daily worries, their daily survival, is really, really hard to contend with. And I think that is what makes this outbreak so difficult and worrying, is the fact that it is a compounded effect, that people will deal with their security issues as well as now a very fatal strain of the Ebola virus.
Yusra, joining us live from Johannesburg. Good to see you. Appreciate the update. Thank you.